We all want to feel younger, but do the majority of us want to look younger? The answer is yes, 100% yes. So the next question is, how do we do that? In this video, we'll go over some supplements, skincare products, and lifestyle adjustments to make that happen. Let's get started. First, we'll start with skincare routines. Honestly, I'm not the guy for you to watch. If you want a celebrity-endorsed skincare routine, watch her. But when it comes to slowing down skin aging, I have some tricks up my sleeve. When it comes to a face moisturizer, we normally would like a morning and a nighttime routine. The reason is the sun. That one, not that one. A brand that I'm not sponsored by, but I do like, is CeraVe, not to be confused with Michael Cera.
I'm Michael Cera, and I'm pleased to announce that this is my cream. CeraVe.
Anyway, they have an AM and PM facial moisturizer. The main difference? Sunscreen. Why? Because of the sun. We just went over that. If you don't get much sun during the day, then you can probably get away with just using the PM facial moisturizing lotion in the morning and night, and applying an additional sunscreen separately on the days you do decide to catch some rays. If you don't want to use CeraVe, then just look for a product that contains ceramides, hyaluronic acid, and niacinamide, which is vitamin B3. Those are the main ingredients that have been researched to actually prevent skin dehydration and keep the skin silky smooth. Okay, let's move on to discuss some supplements to keep in your skincare regimen for maximum benefits. First one is vitamin D3. From this study, we see that subclinical and clinical vitamin D deficiency, less than 30 nanomoles per liter, in the general population has become a global problem worldwide. Why? Because nobody goes outside anymore. Now, I know that some places don't get much sunlight, especially during the colder seasons, but I live in Southern California where it's 85 degrees in December, and the amount of people that have low vitamin D is still high. But I'm not the one to talk. My vitamin D just a few years ago was 10. So long story short, get some sun. Also, with advanced aging, the capacity of the skin to produce vitamin 3 decreases irrespective of the season, and the degradation of its active form increases. It was found that the concentration of the precursor vitamin D3 in the skin declines approximately by 50% from age 20 to age 80 years. Unfortunately, we can't do much about getting older. Also, I just said to use sunscreen in the rare event that you're under the sun for a long period of time because of skin cancer. So you need vitamin D for not only skin health, but overall health, and you get it from the sun, but you can also get skin cancer from the sun without sunscreen. But if you apply sunscreen, you won't absorb vitamin D. That's where supplementation comes in. Depending on your vitamin D levels, you might need 1,000 IUs or 5,000 IUs or possibly even more. Get blood tested and make sure your levels are optimal in the 50 or 60 nanogram per deciliter range. Do this all under the care of your primary physician. Next supplement that has proven to help with skin health is hyaluronic acid at 200 milligrams per day. This study showed that oral ingestion of HA may suppress wrinkles and improve skin conditions. The dose used was 120 milligrams, but normally 200 milligrams is used. Why hyaluronic acid? Hyaluronic acid is present in all connective tissues and organs, including the skin and joint fluid. It's what gives your skin structure and is responsible for that plump and hydrated look. We don't want the skin to look dehydrated, and hyaluronic acid helps with that. I mentioned that you should take a topical product that contains hyaluronic acid in it, but it's still beneficial to take the hyaluronic acid in a tablet or capsule form to maximize benefits. Some multivitamins do contain it, so just check the label before buying it separately. And the last supplement that is a bit controversial is collagen peptides. I believe that taking collagen peptides is beneficial because majority of people do not get enough protein in their diet, and collagen peptides helps in two ways. Getting more protein and reducing skin aging sounds like a win-win to me. The dose for collagen peptides is about 10 grams per day. That is a sweet spot for improved skin health and reduced joint pain. It can also help with increasing muscle mass, since we all know that increasing protein intake helps with muscle building, but it is a very inefficient way to do it. You'd be much better off taking a separate whey protein powder to get your desired protein intake for the day. How much protein should we be ingesting each day? That's a perfect segue to our next section, lifestyle changes for slowing down skin aging. Diet plays a big role in how our skin looks. Salty, highly processed foods are not only terrible for our skin, but for our health as well. Lean proteins like chicken and fish are great for skin health. To preserve muscle, we should be aiming to get 1 gram of protein per pound in body weight, or 2 grams of protein per kilogram in body weight. The best way to do that is by getting enough through diet, then either 10 grams of collagen peptides or a whey protein, depending on if your goal is to improve skin health or improve muscle mass. Since majority of you guys watching this video are interested in skin health, the recommendation is 10 grams of collagen peptides to meet your protein needs. A great diet for health overall is the Mediterranean diet, rich in whole grains, fruits, vegetables, and lean protein. There are countless studies that consistently point to the Mediterranean diet as being one of the healthiest, if not the one to rule them all. Next, we have exercise. We all exercise, right?
Absolutely, I do.
Exercise helps us not only look younger, but feel younger as well. How? It increases blood flow and circulation, helping bring more nutrients and oxygen to the skin. Oxygen is pretty important. A common question is what kind of exercise is best? And to be honest, most of the people asking that question don't exercise at all. So the answer is anything, just exercise. Whether that's going for a 20-minute walk out on the street or doing an Ironman triathlon, just start with something and stick to it. Lastly, we have sleep. There's nothing worse for your face and mental being than poor sleep. Invest in a good mattress. You'll be laying on that thing for about 33% of your life and improve your sleep quality. You know what else helps with sleep? The sun. See, it all comes full circle. Sunlight first thing in the morning can really help with falling asleep at night, which can help with reducing skin aging. If this video was helpful, please leave a like and subscribe to the channel, and I'll see you all next time.